Dear colleagues, hello everybody. My name is Benedikt Hofbauer. I'm a self-employed rural general practitioner in Austria in a single-handed GP practice. Till now, I treat no patients suffering from corona disease. Maybe I do not know about the infection of a patient or even myself. In my surrounding, there was one colleague who was infected in her practice and another one who was quarantined. So we all are concerned that our JP practices could be closed in case of contact to a COVID-19 patient. One of the main problems as a JP is that the possibility to test was limited in the last weeks. It seems to improve now. Another problem is the lack of protective equipment despite the great efforts of our government. In my practice, there's a real shutdown in my daily work. Consultation now is mostly done by telephone. This works better than I thought, but it is very exhausting. And I'm worrying that many of my patients with chronic diseases may not come because they are afraid of getting infected. We try to establish active surveillance by telephone. The few patients I treat in my practice have to make an appointment. I call them back and we decide if a face-to-face contact is necessary. This minimalistic approach to family medicine is quite unsatisfying for me because this has nothing to do with the way I like to work in normal times. However, there are positive experiences as well. People are more friendly with each other. They are very thankful for having contact with me as their doctor, even by telephone. There's a lot of readiness to help others, for instance, to support the elderly or neighbors. And many of them emails I receive and even television news are closing with encouraging greetings. We also have to cope with our children and their closed schools or universities, many unemployed people, and not being allowed to meet our friends and relatives. All this is reasonable but hard. Of course, we are glad that the set of measures seems to be effective, and there's a low rate of severely infected or dying patients or even colleagues. And we're in sympathy to people in other countries that have been hit hard. Kind regards, Benedict.